Hi, my name's Lori Handy. I'll be speaking to you today from the Children's Hospital of Philadelphia Vaccine Education Center. Today, we'll be talking about the different regimens for protecting your children from measles, mumps, rubella, and varicella, or chickenpox. Some families may be aware that there are two different versions of vaccines available to protect your children. One option is a combined vaccine, in which the vaccine protects against all four infections together. This is called the MMRV vaccine. The other option is a regimen in which protection is divided into two separate vaccines. Measles, mumps, and rubella protection is in one vaccine called the MMR, and varicella, or chickenpox protection, is in the other. We'll just call it V. So what is the difference between these two regimens? When thinking about the regimen in which there's two different vaccines, MMR and varicella, what we know is that giving a 1-year-old the 2 doses of vaccines is generally well tolerated. We'll see a low rate of fevers in children in those first 1 to 2 weeks after they receive their vaccine series. However, in 1-year-olds, when we combine them into a single vaccine, MMRV, we tend to see a slightly higher rate of fevers in those first 1 to 2 weeks. Because there is this higher rate of fevers, we also see an increased rate of febrile seizures. Febrile seizures are when a child has a convulsion related to the onset of fever, even if that child has never had a seizure before. For this reason, this vaccine is not recommended in children who have a personal history of seizures, febrile seizures, or a family history of febrile seizures. There is the benefit that this is only one shot, but when thinking about these risks and benefits, many pediatricians generally recommend giving these vaccines separately. Children do receive a second dose of these vaccines at ages 4 to 6 years of age. Reassuringly, we don't see the same risk of higher fevers or febrile seizures in the combined vaccine when given to older children. For this reason, it's more commonly given as a combined vaccine in this older age group. Thank you for taking the time to listen today.